Hey guys, it's me, Dr. Katz. I wanted to talk to you guys about kind of a life after chemo topic because it's important, and there's lots and lots of cancer patients out there, including thousands even in my own town of Monroe, and I feel like this is something that needs to be heard. So let's get cracking. So first of all, the good news is that we are getting better and better at helping patients survive cancer. That is awesome. Woo! Like I'm a survivor myself, right? But see, the double edged sword of that is that as people are surviving longer and longer, we're also getting to know more and more about the long term side effects of chemotherapy and their treatments. So let's talk about what a late side effect is, right? So a late side effect is anything that you experience after treatment is over, right? They can even occur years later. Like for myself, I'm still having neuropathy. I have more headaches than I ever did. My stamina is not quite what it should be. I have lots more aches and pains, etc., etc. But so far, besides the neuropathy, I've had the muscle pains, the headaches, the nausea, the severe hypothyroidism, the renal dysfunction, quote unquote chemo brain. I've had stomatitis with like ulcers all over. I've had fatigue. I've had the cough, shortness of breath, hot flashes. I am really in a bind every time that they ask me any of those COVID screening questions. Because, like, the real answer is yes, but it's not yes for the reason that they think it's yes. It's yes because of all my chemo side effects. So I just say no because I don't want to send anybody on the wrong track. Anyway, sorry, I digressed, but I may be forgetting a few of these side effects, but those are the ones that come immediately to mind. And to be honest, I'm like, enough already, right? Like, aren't we done? So let's talk about the main types of cancer treatments. Okay, so we've got chemotherapy, we've got hormone therapy, we've got surgery, we've got radiation, we've got targeted therapy, and immunotherapy. So let's take a little look at each one and see what they're really about. Now, before I go into this, I want to remind everybody that I am not trying to imply that we as patients don't all get counseled about treatment before we get it, right? I mean, technically, we all have to sit down and sign like a mountain of consent forms before we consent to any kind of receiving of treatment for our cancer, right? Some places do it better than others. Most sit down, do a one-on-one chemo teaching session, and the patient can ask questions and get clarification. And this is a great opportunity to really start to appreciate what you're getting yourself into when you say yes to treatment. But unfortunately, after this fab teaching session, right, there's still usually a 20 plus page consent that you're supposed to sign as well. And I'm going to tell you, nothing undermines your confidence like thinking you just covered all your bases, and then you look at this huge document plunked in your lap that you're supposed to pour through to make sure that you really get it. And I think that a lot of us, myself included, we do our best, but there's no way to digest all that additional info effectively in that short amount of time. But we sign it anyway because we want that cancer gone. You know what I mean? And I mean, it's a tough spot for any patient to be in because you want that cancer gone, but you don't fully realize what you possibly consented for in exchange. I mean, yes, I'm going to talk about side effects and other potential cancers. This is what we're really going to get into. So let's look at the kind of late side effects that are possible with each kind of treatment, okay? So like radiation, for example, it causes all kinds of late side effects. Cavities, tooth decay, increased risk of other cancers, coronary artery disease, increased stroke risk, hypothyroidism, heart and vascular problems, early menopause, intestinal issues, memory problems, osteoporosis, infertility, and lymphedema. Yay! So now surgery, another type of targeted cancer treatment, right? Main side effect of surgery is going to be infection risk at the time. And the main late side effect is going to be lymphedema in the area that was operated on. Like I have lymphedema right here next to my neck, which is where they did a big dissection of all those lymph nodes. And it's like I get my lump back every now and then, which of course freaks me out until I take a step back and be like, oh, okay, I know what that is. That's just a collection of fluid. But I don't want to go to lymphedema clinic because that's just going to move it somewhere else. And who knows what side effects I might get of that, right? So let's talk about hormone therapy. So that's another type of cancer treatment, right? So with hormone therapy, as far as risks, it comes the risk of blood clots, hot flashes for men and women, okay, menopause, sexual side effects, osteoporosis, and risk of other cancers. Now, the last two main categories of cancer treatment are the immunotherapy and the targeted therapy. Now, they're still new enough that we don't know a lot about possible late side effects. Now, lucky me, I fall in this group. Actually, I fall into the immunotherapy and the chemotherapy group. So I'm just going to keep you posted on that one because we just don't know. They're new enough that we just don't know. But the point I want to make is that it's not all in your head when you're still having symptoms long after chemo. Okay? We don't really know a way to prevent them altogether. But if you're having them, speak up. Talk to your doctor. Make sure that something else is not going on. Something else with your cancer or another condition. Because even when your cancer's over, right, that your job is not over. And what job am I talking about? I'm talking about your job to still continue to advocate for yourself, to watch out for your body, and to speak up when you think something's not right. So let's think about that for a little bit. And any questions? You can always call me at the office, 734-242-5588, or you can look up our website, LoriKatzMDPC.com, or our Facebook at Lori Katz MDPC. You guys have a great day. Thanks for listening. Bye-bye.